Hi, my name is Paula and I'm a new mom. Thank you for listening to our podcast, To Morning Sickness and Beyond, where we were joined by Dina and Bianca, who shared with us their story of experiencing hyperemesis gravidarum. Today I'm joined by Tanya Hobbs, who is now let me get this straight, registered nurse
Nurse, yep.
specializing in perinatal
Yeah, certified in perinatal care.
certified in prenatal
Yep.
care, and a birthing coach.
Yes, birth coach.
Okay, birth
Exactly.
coach. Perfect. Well, thank you. Welcome.
Thank you for having me.
And so let's start with what's perinatal? What does that mean exactly?
So perinatal is essentially a subsection or a subspecialty of nursing or of the medical field, which generally will encompass the period of pregnancy. Can sometimes also include preconception, so the period when you're trying to get pregnant, pregnancy, the birth and delivery period, and generally the postpartum period, which ranges usually for the first 6 weeks or so after you give birth. So that period of women's health, of the lifespan, is what I specialize in.
Okay, perfect. And then the birth coach part,
Yeah.
explain that a little
So
bit.
birth coach is essentially it's not a regulated profession or anything. It's a term that I use to describe the services that I offer privately.
Mhm.
So my background is that I am a registered nurse, so trained in a nursing school, worked in the hospital in the labor and delivery ward for quite a while, several years. And then I decided for various reasons to kind of break off from the healthcare system. And now what I do is I take on private clients who essentially use me for doula services. If you've
Okay.
ever heard of a doula,
Yes.
so I offer prenatal classes privately. I attend their births. I offer phone and text support, postpartum sessions, things like that.
Perfect. Well,
Yeah.
thank you very much. We're very lucky to have you today, especially for what we're going to talk about. So, I looks like I've been saying the term wrong the whole time. It's not hypermesis gravidarum. It's hyperemesis. Correct?
Correct.
Okay.
I'm not too picky about. I don't
Yeah.
think anybody
We'll
minds.
just call it HG for the purpose
Sure.
of facilitating the conversation. So, you were saying earlier, we had a few minutes to chat before, and you were surprised how I knew two people that had HG because it's a very rare condition, you were saying.
Hmm.
And lucky for this podcast, yes, I know two people who've experienced it and they shared their story. So Dina and Bianca both experienced HG in two very similar ways, but also had their differences. So let's start with Bianca because I think she started to share her story first in how she just started feeling very sick, and I think what she said was she would start logging how many times she would vomit. And my question to her was when did you know you needed to seek help? Like when did you know was the time that, this is not regular morning sickness. There's something wrong. And she had responded, I started logging how many times I was vomiting in a day, and it was going up to like 25 times.
Yeah, which is
That for me
intense.
was like shocking.
It is shocking.
And so my question for you is, you know, that was her way of seeking out help. When should one, you know, kind of raise a red flag in their mind and say, it's time to go see a doctor. This is not regular morning sickness anymore, despite what professionals may tell me that it is.
Yeah. So definitely what I like to tell my clients or any patients that I encounter is as soon as you have any pregnancy symptom, really, whether it's nausea and vomiting, like in hyperemesis or anything else, if it's something that's affecting your quality of life negatively, if it's affecting your functioning, right, which they talked a lot about when Bianca and Dina were talking about their experiences. So your functioning, right, not being able to work, not being able to care for your other children, not being able to go outside for a walk, let alone, eat or drink anything, that's definitely worth mentioning to your physician. I'm not sure any physician necessarily will use a number of times of vomiting per day as the strict criteria,
Mhm.
but typically for hyperemesis specifically, it has to have a negative and significant impact on your quality of life, on your ability to nourish yourself. So typically it'll be associated with weight loss in pregnancy as opposed to weight gain, which is what we expect.
Mhm.
So that's one of the red flags that you need to look out for. Dehydration. So typically there'll be some testing required, like blood tests amongst others, and typically you'll see things like electrolyte imbalances, which can reflect dehydration, malnutrition, things like that. and a variety of other things. They can do, physicians can do physical exams to see, how you're appearing as well, your reflexes, things like that.
Mhm.
But, whether you end up receiving a diagnosis per se of hyperemesis or whether you just have severe morning sickness, the terminology, right, is more so used in a clinical sense for guiding your treatment. But you as a person, what really matters is that your symptoms are addressed and that your well-being is addressed and that you feel like somebody is actually listening to you and giving you the help that you need, whether it's just nausea and vomiting or if it's something more severe. As soon as it's affecting your quality of life is what I would use as the barometer for that.
And I remember, to your point, Dina was saying in the podcast, everyone around me was saying that, it's just morning sickness. Some of her doctors, I believe, were also saying, it's okay, it's morning sickness. So, like, when should, in Bianca's words, someone like step up for themselves and tell their physician, like, no, there is something wrong with me? Like, it's hard because it's like you're telling the medical professional, that there's something wrong, and that's kind of going against the grain of authority. So,
Yeah.
I mean, again, you'll say quality of life, but um, I don't know, like, are there tests that they should be asking for, or I don't know what could be done.
So I wouldn't necessarily say tests that they're asking for. But again, I would always bring it from the perspective of what you're feeling, right? So you're
Okay.
not necessarily, bringing a printed Google sheet
Right.
of like, this is what WebMD told me kind of
Yeah.
thing. But always reframing it, right? Saying, if you're being told, for example, this is normal, right? And this is just sidebar here. One of my pet peeves about obstetrics in general is right. Oh, I'm pregnant and I'm feeling XYZ discomfort
Yeah.
or symptom. And oh, that's normal, right?
Right.
And it's true, right? Unfortunately, pregnancy does often come with quite a lot of unpleasant symptoms and sensations and things. But just because something is normal for some people does not mean that we should just, say, oh, too bad, right? Too bad, so sad, you're pregnant. Once you have your baby, it'll go away. There are things that can be done. And again, the quality of life. If you feel like your functioning is impacted, if you feel like your mental health is impacted, that's worth reporting, and any clinician worth their salt really should be paying attention to that.
Mhm.
So I would always tell my clients, for example, if you feel like you're being dismissed, you can say something like, I understand that this can be normal in pregnancy sometimes, but I really have to say that it is affecting XYZ in my life,
Okay.
right? I feel like my mental health is being negatively affected, my sleep, my ability to work or function, for my livelihood, my ability to care for my other children, things like that.
Okay.
Be really concrete and describe specifically, right? Not just I'm
I don't
feeling
feel well.
unwell,
Yeah.
right? The more, medicine is a very quantitative science, so physicians really like when we can give them data, right? So the log was a great thing I think that Bianca did in
Yeah.
terms of writing down, right? Not just I feel nauseous all the time, but I vomited 25 times in the last 24 hours, right? That's what will get clinicians' attention typically
Okay.
is when you have data
Data.
and more concrete things that you can report, including, right? I was only able to drink not even half a glass of water in the last 24 hours. All I was able to eat in the last 24 hours was 2 saltine crackers, right? Obviously, we know that that's not sustainable when you're growing a child, when you have a
Right.
fetus.
Yeah.
So those kinds of things will typically lead clinicians to take action or at least ask for more testing.
Okay.
And it's really appropriate and okay in the medical system if you really, after saying things like that, after bringing up data to your clinician, if you still feel like you're being dismissed, it's okay to also ask for a second opinion, right?
Okay.
Like sometimes it'll be, I think was it Dina who had gone to a couple of people or
Yes.
doctors and
Yes.
like it's normal. And there was that one nurse at that
Mhm.
one OBGYN clinic who was
Yeah.
like, you know what, I think you don't look so good, right?
Yeah.
You're like sweaty and
Yeah.
I think you should maybe see a doctor today. So as much as it's unfortunate, sometimes you really do have to advocate for yourself in the medical system and try to push a little bit. And if you're uncomfortable doing it, you can also bring, a family member,
Yeah.
a friend to an appointment who can kind of vouch for you like, no, I promise she's not like this usually. Like I can see a difference in her being the pregnant person.
Yeah.
Those are all strategies that are completely appropriate.
So coming back to the condition itself, Dina was saying that once they did diagnose her at the hospital, she went to a hospital here in Montreal who's very like it's researched there. They know about it, but it's not, if I'm not mistaken, it's not like a super known condition. Like pregnant women, I don't think all of them know about it. It's not something that, I'm going to get pregnant and I'm going to Google because I don't know about it. So what's going on in our body that's causing this, or even if they even know the cause, I don't know, but
Yeah.
what's different? Like what's going on in the body to cause this huge discomfort?
Yeah, so in general, I would say most people or most pregnant people are aware of nausea and vomiting in the
Yes,
first trimester at
right.
minimum. And that typically, it's fairly well understood. It tends to be hormonal, like hormone
Mhm,
related, right?
mhm.
So you have peaks in estrogen, peaks in progesterone, peaks in HCG, which is the pregnancy
Pregnancy
hormone. And adjusting to those hormones can cause those effects in the body of the nausea, the heartburn, the discomfort that leads to vomiting. But typically, for most people, the majority of pregnant people, by the time you hit 14 to 16 weeks, right, when you're in your second trimester, HCG, which is the pregnancy hormone, decreases, and your body has had a chance to adjust more or less. And there's, for lack of a better word, like a rebalancing, if you will, in the pregnancy hormones. And most people by that time will have a decrease in those unpleasant symptoms for most. But for those unfortunate few, like Dina and Bianca, the body never really adjusts, and for some reason may have a higher sensitivity to hormones like estrogen and progesterone. There's some hypotheses that there's also genetic components. There can be environmental components, but in general, HEG, like hyperemesis specifically, is not super well understood.
No.
Why some people get it and some people don't. There's no, genetic screening or specific test that will tell us, yes, you're definitely prone to
Okay.
this or not.
Yeah.
Unfortunately, it's a little bit of a luck of the draw situation.
Yeah. Yeah. And that's exactly what Dina had said when she experienced it at the hospital. And um, just I remember them saying, which really kind of struck me, was taking a shower was like a good day.
Mhm.
Just getting out of bed. They were completely incapacitated, and Bianca had a experienced this twice, and with
Mhm.
her firstborn, she like just garnered the strength to just read her kid a story. Like that made me
I
cry every
know.
time it's just little things, and I can't imagine already bringing a second child into the home is difficult when you have a first and all your hormones are going all over the place. But I can't imagine, just being completely incapacitated and having to care for another kid. So, um, I know that on a mental level, it's very hard. So, Dina had mentioned that when the hospital had assigned her a therapist, that was extremely helpful. Is that something that I don't know if all hospitals, assign that to everyone? Probably not, but like to your advice, you would probably, I guess, uh,
100%. Like,
thank you.
support that as an intervention for
Thank
hyperemesis,
you.
100%, right?
Thank you. Because
And
it's not only physical is what I'm trying to say.
100%. And can we take 2 seconds to just
Please.
acknowledge, right,
Yes.
how strong those moms are? That is not an easy illness to deal with
Yeah.
whatsoever. It's for a prolonged period of time. And it can feel very hopeless, right? Because unfortunately, we don't have any cure for it. We have supportive treatments, but that's really all it is, right? It's support, it's offering the medications that we can, it's giving IV fluids when we can, it's,
It's a
looking out.
reactive. It's reactive.
Exactly, but there is no magic pill or magic treatment or magic surgery or anything that we can offer these women to really significantly reduce their symptoms. So they're in it for the long haul, right? Their whole pregnancy and for a time that you expect to be happy and exciting and looking forward to becoming a mom, right? It can feel very scary and hopeless. So I mean, kudos to Bianca and Dina. It's not an easy thing to go through, and I think it just that story about how she's able to read she keeps up her energy throughout the day, and just to have enough strength to read a story to her son. I mean, that's to me that's like motherhood in a nutshell, right?
Yeah.
Like that
Yeah.
that sacrifice and
Yeah.
and just pushing through.
Yeah.
So definitely, I thought that was pretty touching as well. And then in terms of mental health, 100%, right? I'm very glad. I was really glad when I heard that when she went to the shim, I believe they had referred her to a therapist because the mental load of that is very heavy. It's very heavy. And it's actually there's quite a correlation between women who are affected by hyperemesis and mental health conditions, including prenatal or postpartum depression and anxiety, because it just you don't feel like yourself whatsoever, right? You're physically drained, you're malnourished, your sleep is often affected, your hormones feel like they're out of whack, and it's just a very heavy thing to have to hold. And I know that they had both mentioned as well in their podcast how they felt like they couldn't be productive anymore, like they weren't themselves, and the way that our society is built in North America, our productivity feels so entwined with our worth.
Mhm.
Things having to be productive and measurable outcomes, and if I'm not able to work, right, I don't feel productive, and how that really affects our self esteem. So in general, whether you're affected by hyperemesis or not, I think it's really important that we have a conversation for pregnancy how you really need to reframe productivity, right? So growing a baby is productive.
Right.
Sleeping when you need to is productive.
Right.
That rest that your body needs to grow your baby is productive. So for women particularly who have this pressure in our society to just go, go, go and do, sometimes feeling like you can't do anything really does not make us feel good about ourselves.
Mhm.
So it's important to just give yourself a lot of grace in pregnancy, regardless of your symptoms, but especially if you're dealing with an illness like that resting, trying to hydrate yourself, and just taking time for your mental health is productivity.
That's an excellent point. And I think also, asking for help or support, whether it be on the outside, like a therapist or a doctor, or even at home, like
Mhm.
their partners, their husbands had to take on, all the household chores,
Mhm.
taking care of the previous child if there was one, or oldest child. It's not being afraid to ask for help. And I think that also, like, women have trouble asking for help because they're in our society are expected to do everything, take care of the children, cook,
Mhm.
take care of the family, this and that. And so I think that pushing ourselves a little bit too far and a little bit too thin can also be dangerous because, like you said, we're growing a human being. So, rest is important and caring for yourself is also very important. So, can I ask in your career, have you've seen HG before? Have you,
Yes, of
okay,
course, of course.
was it like a common thing that you saw or no?
No.
No.
And I worked in a tertiary hospital, so a high-risk pregnancy center where we did see a lot of antenatal patients, so who were hospitalized during their pregnancy for a variety of reasons. And I did encounter on several occasions patients with hyperemesis who were not able to keep down food or fluids and so needed to be hospitalized for that hydration and to try to slowly, gradually introduce what we call like a dry diet, which is I think what Dina was
Yeah.
describing in terms of we'll start on dry toast. That's all you get on your
Yeah.
hospital tray, and we see how that goes. And then at the next meal, a dry toast and maybe something else. And then we see how that goes for a day or two. And then until you're able to nourish yourself enough to go home. But it's not that common. I was trying to look this up, and it's somewhere, most sources will say somewhere between 0.5 to 2% of pregnancy. So
Wow.
it's really not very common that you'll have such severe nausea and vomiting that it really completely wrecks your quality of life and your ability to take care for yourself or shower, right? It's mentally draining, but physically, right?
Mhm.
Just the weakness of not being able to hydrate yourself, even if you weren't pregnant, right? And then now imagine
Yeah.
all your body needs because you have a second person
Yeah.
inside you, right?
Yeah.
Which is just it's crazy. So yeah, it definitely is something that I encountered. And every time, as a nurse, it always pulled at my heartstrings because again, there's only so much we can do for
Yeah.
this particular condition. So it's a lot of that supportive therapy,
Right.
sitting with the patients when we have time. How are you feeling today? Making sure that, we're helping them with their hygiene care. That whole shower thing where
Yeah.
you have to sit on a bench, right? We would wash the patient's hair. We had like these special basins as nurses that we can do. And sometimes just that, right? Just a day where, today is Tuesday, it's shower and wash the hair day. And then that would, make them feel much
Better.
better. It's little goals like that. You would just have to break down the day hour by hour, little goals, small meals, small sips.
Yeah.
Everything just has to be really baby steps when you're dealing with something like that.
And lastly, I just wanted to go over what Dina had said that it was so painful. Her pregnancy was such a nightmare that when she gave birth to her baby, obviously she loved her baby and everything, but she was kind of feeling a bit resentful, I think, that, this creature that she now, I mean, obviously loves and always did, but like did that to her.
Mhm.
So a second pregnancy is obviously not in the books for her. Bianca did do it twice bravely because her doctor had told her that it's not 100%
Mhm.
sure, but I mean. But yeah, I mean, could there be post birth, like after you give birth to this child that made you extremely sick for 9 months, could there be some sort of like mental resentment towards your child after they're born?
Definitely, and any kind of pregnancy complication that's severe or that really affects you as a pregnant person is a risk factor for postpartum depression,
Mm.
including something as simple as unplanned pregnancies. Right, when we weren't maybe in the mental space for having the baby that we end up having, that's a risk factor as well. So definitely, any prolonged hospitalization or illness can definitely come with mixed feelings, postpartum and prenatally. But I also think that we need to have a conversation about normalizing that not everybody enjoys being pregnant,
Right.
right? Because again, I enjoyed the fact that both of them had discussed how, you have these expectations and
Yes.
social media and Pinterest and all these things where, pregnancy is like having this cute round belly and you're in a field of
Yeah.
flowers, right? And you're just glowing and it should be this wonderful, exciting time.
Yeah.
But there's quite a big chunk, or right, like a significant amount of women who are pregnant who don't necessarily enjoy being pregnant. The hormones are difficult on them. They have really unpleasant symptoms. Some of them deal with chronic pain, with HEG, with all sorts of things, really. And that's kind of stigmatized, right? Because you should be so thankful, right? And you'll even, people go with their comments like, well, at least you were able to get pregnant,
Oh
right? There's always
God.
something.
Yeah.
And women kind of, I think, feel guilty, right,
All the
for not
time.
enjoying their pregnancy.
Yeah.
And I think it's okay, right? It's okay if you hate being pregnant.
Yeah.
Not everybody likes it.
Yeah.
And it doesn't mean
Doesn't mean you
that
hate
you
your
can't
child.
no, right?
Yeah,
It doesn't mean you love
exactly.
your baby any less. It's
Right.
you can hold two things at once,
Yeah, two things
right?
are true. Yeah.
Absolutely. You can really dislike being pregnant and also love your child, and it can be a very wanted pregnancy.
Mm.
And it's okay to have mixed emotions at any point in the prenatal or the postnatal phase.
Yeah.
And I think that's maybe not talked about enough.
I agree. I think this whole condition is not talked about enough.
Yeah.
Crazy. They also said at the very last part that it lasted their whole pregnancy and 9 full months, and that the moment they gave birth, it just like stopped. That's crazy to me.
Mhm.
Like, how's that even possible physically? It just stopped.
Yeah.
It's like someone's like burning you, and then all of a sudden,
Yeah, because again, even though we don't understand fully the condition, the main hypothesis is that it's hormonal,
okay,
right? And so when you do give birth, there's a huge shift in the hormones, right?
okay,
The estrogen, the progesterone decreases dramatically.
okay,
And so I'm not necessarily surprised that many women who do have HEG feel that way after they give birth.
okay.
Um, yeah, so
Wow.
I don't think that's that uncommon, and it does make sense physiologically.
Well, thank you so much for joining us and shedding some more light on HG and the effects and what to look for. And I hope to see you again very soon on another one of our podcasts.
Well, thanks for having me.